as we move our program along, I'd like, if you don't mind, we're going to shift it a little bit according to the agenda. We want to hear from Madam Mayor, okay? So we want to prepare to have a conversation with Mayor Stephanie Rawlings-Blake, because it is because of her efforts, because of her emphasis on women, because of her emphasis on business that we're here today. And so I'm real happy that I have a mayor that's a transformational leader. You just took my words away.
Sorry.
We have a mayor. I'm only teasing. We have a mayor that is down in the trenches when it counts. I just can't tell you just how inspirational she is, and you women can appreciate this. And by the way, Vidal, she loves CoverGirl. But I don't know if you know this, but she was been recognized as one of the best dressed mayors in the world. So I don't need to say more. I've said enough today. This is Madam Mayor Stephanie Rawlings-Blake.
Thank you. Good morning, everyone.
Good morning.
I said, I don't know. I feel like I was the only one dragging after hanging out with y'all last night at the award ceremony, but we made it here this morning. Congratulations to all who've been in this marathon week of events. I'm excited to be here with so many talented and innovative women, and I caught the tail end of the find out your real age and all of the useful information, so I'm excited about taking a look at that. I think every time you can find just a little nugget to take, that's what helps us along the way. And I know that you talked about creating a habit, and I mean, that's how I've been able to do it, you know, just with little tweaks, and I've talked about that before. Little things that can become a habit, and you can sustain them, and you can transition yourself consistently but gently into a healthy life for life. So I want to thank you for that presentation. I also want to thank several of you for being here. In particular, I want to thank Michelle Brown, who is here on behalf of our Senator, Barbara Mikulski. You know the Senator is one of my favorites, and I always like to see you at these events. Thank you for being here. You're a true community partner, and I appreciate that. I also want to thank Trudy Perkins, who is here on behalf of Congressman Cummings. Thank you very much. I have conversations often with the congressman about health and how we both have to be focused on health, because there's too much good work that both of us are doing that to miss out on it because we are not taking care of ourselves. And there's busy people who are everywhere. I'm his reminder, and he's my reminder, so I appreciate you being here. And I want to thank Carolyn Blakeney for being here on behalf of Council President Young. I will say that you do a much better wobble than the Council President, so I appreciate you standing in and representing him. I also like to thank Sharon Pender and the entire Mayor's Office of Minority and Women Business Development team. We have a fantastic team, and let's give them a big round of applause. I want to thank all of our speakers who are here with us today for sharing their time and their talent with us. Our exhibitors, we have the Health Department, Baltimore City Health Department is here, American Heart and Stroke Association. I want to thank our sponsors, CoverGirl, and yes, I am a fan, and Southwest Airlines. I'm a fan as well, except for the fact that I don't know what they're doing with their drink tickets. Where did the drink tickets go? I have lodged a formal complaint. I have. But I do want to thank our sponsors for adding that, you know, the bonus, that little extra to make this week special. So we're all here because we believe that when women succeed, our families succeed, and our communities succeed. And right now across America, women are stepping up in every way, as executives, as entrepreneurs, and as leaders. And this is amazing for our country, but most importantly, it's inspiring for future generations of young girls who look up to all of you who are assembled this morning. I am humbled every time a little girl comes up to me and wants to take a picture or wants to tell me that she's going to run for student government or something like that because of me, you know, the inspiration that she believes me to be. And I'm so humbled because I remember the women who inspired me. I remember being introduced to women like Senator Verda Welcome, who was one of my father's mentors, and I remember she almost had a glow about her because I saw her as being someone that was so powerful and influential, and you're shaped by your experiences. It never occurred to me as a young girl, as my parents made sure to introduce me to so many women who were doing incredible things, it never occurred to me that as a woman I could not pursue my dream of public service. That I would be only the second female mayor of Baltimore. I didn't even see it as obstacles because of what I was introduced to. So I'm so honored when I get a chance to be that role model for young women. And make no mistake, all of you wonderful women are showing that given the same opportunities, women can flourish. Promoting investments in the advancement of women in the workplace makes companies stronger. It helps lift up our families out of poverty. It helps to stimulate economic growth. But this morning, we're not here to talk about success in business, but to ensure that our business doesn't detract from our biggest priority, our health. Taking care of your parents, your children, your husbands, everybody, your career, always seems to take priority on the to-do list. But for many of us, weeks full of meetings and evenings, events disrupt our schedule, and it's easy to let your health fall to the very bottom of your priority list. Believe me, this became too real for me in September when I got a really bad lung infection, and I could, giving a speech like this, I would become winded. But I wasn't going to be deterred. It was Star-Spangled Spectacular. The city was aglow. I had new red, white, and blue outfits I was planning on wearing. I was like, I will not be deterred. I said, give me some Mucinex, some Alka-Seltzer Cold. We're going to work this out. And I just kept going and going. Literally, every time I'd have to do an event, I would just get through it, just enough to get back in the truck and to just, to try to collect myself because I was physically exhausted. And the worst part about it is everybody could see it, and they were telling me, Steph, you just don't look good. You really need to take a break. I know this is Star-Spangled Spectacular. You don't sound good. You don't look good. I was like, all right, let me just do a little bit more bronzer, a little bit more. I'll get it together. I said, especially for the fireworks, because I had a new dress and I wanted Biden to see it. I was like, I am going. We're going to work this out. And I just remember sitting there, and I couldn't, it went from being short of breath to I couldn't catch my breath. And I still wouldn't move. I was sitting on the stage. I was like, all right, I'll just cut this part out. I'll just cut this part out. I'll just make it a little shorter. And, I made it through. And I'll get to the end and tell you how silly I was at the end. But I made it through, had enough sense to come down off the stage. And by the time they checked my oxygen, it was less than 80%. So I was lightheaded and everything because my lung infection was just that bad, and it finally hit me. I was like, you're really being stupid, because if any person even if you didn't like the person, you would tell them to do better than what you did for yourself. And if my friends are sick, my coworkers are sick, I implore them to slow down, to take care of yourself. There's only one of you. But when it was me, I didn't make those wise choices. So take it from me. It's a lesson that I hope that I've learned for the last time. I have decided that I am going to take time for myself. I have officially taken 2 days off since, when I'm like, do not bug me, don't talk to me, don't text, don't whatever. I'm taking a recharge day, and it has been helpful. But hopefully, as time passes, I will retain that as a habit and won't allow myself to get run down again, because there's too much going on, as I often say and the congressman admonished me. We just have too much work to do and too much to give and to experience to not take care of ourselves. So with it being October, I'd like to take a few moments to talk about something that's close to my heart. And I know I don't want to be too long, Sharon. I don't want to get the Sandman out after me. This is Breast Cancer Awareness and Prevention Month. We know 1 in 8 women will develop breast cancer once at some point in their life. Unfortunately, in Baltimore City, we have the highest mortality rate in the state from breast cancer, and I said yesterday at one of our events, I like being first in a whole lot of stuff, but this is not something that we need to be first in. I think we can do better and should do better for each other, and that means encouraging your friends and your families to get a breast exam after 40. You need one every year, and I was very clear yesterday when we talked about it. You don't have to look 40. I know some of us say, well, I don't look 40. It doesn't matter. Once you have to write down 40, or once the clock ticks or the calendar ticks and you are 40, you need to start the clock on getting your mammograms annually. It is important. How many people here know someone who's lost their life to breast cancer? All right, let me do this the other way, so hopefully this will make the point. Raise your hand if you don't know anyone who's died from breast cancer. You see this? That's how important it is. It touches almost every single one of us. And every hand that went up is another family, another community that has been impacted. The ripple effects are real, so we have to take time out for our breast health. And I think it's something that, I'd like to do a whole lot of stuff with my girlfriends. If that's what gets you there, take a girlfriend with you. Both of you do it at the same time. You all can lament. I was joking yesterday, you can lament over cocktails after and get over being squeezed up. I said usually when you get squeezed up much, you get at least dinner or drinks anyway. You might as well, if you need to, get it with your girlfriend. Get it with your girlfriend, make it fun. Make it fun, but it's important. We know that breast cancer is beatable, but it's only going to be beatable, and we're only going to do better for ourselves in Baltimore if we spread the word. There's no reason for anybody with as much access to health care as we have in this city. There's no reason for anyone not to do the preventive care that you need in order to be healthy. We know that there's some things you can't avoid. You can't pick your parents, so your genetics are baked. But that's not really what's taken most of us out. It's not what we came in with, it's what we're doing after we get here and the choices that we make. So let's make this year, as we, from year to year with our women's event, let's make this year about empowering ourselves to make the changes, little as they may be, to put ourselves on the best path forward for good health. I want to see all of us, all of you, back here again next year, and there's no way that you can be a superwoman unless you take care of that superwoman. So thank you so very much for coming here again to all of our sponsors and speakers. We couldn't do it without you. Sharon, back to you. Thank you.
Wasn't that incredible? And at the end of the day, Mayor, this is what this session is all about. That is why it's entitled Rescuing Superwoman. Before we go into the next speaker, and we have some more prizes, I'd like to bring up to the front someone who's very dear to me, and someone that you need to know. She is the executive director of the Maryland Women's Heritage Center, and she doesn't know I'm going to do this, but she has given a whole lot, her entire life, to the cause of capturing historical information about women. And in case you've never met her, I want you to meet her today. She does not know I'm going to ask her to come up because we'd like to give her a certificate of recognition and recognizing the years that she's committed to being the founder and executive director of the Maryland Women's Heritage Center. And she's decided to step down, and I just want to tell you, heart to heart, we'll miss you. But we know that your legacy will go on. And I got to tell you, if you've never had the Jill Moss Greenberg experience, she is a walking encyclopedia of knowledge of women history, particularly in the state of Maryland. So would you come forward so we can give you the citation? You want another prize? Yes. You sure? Yes. No, don't dance. But actually, let's have some music as we, if I can get one of our sponsors, Joyce Shiraz from University of Maryland, University College, to come pick our prize. This time.
Okay. Should I call the number?
You can call the number.
685-3256.
Now, we do have more Southwest vouchers left, but before we do that and before we give away the prize from the American Heart Association, I'd like to bring out our next speaker. Do you all have a little bit more time? We're running a little behind, but we have some dynamic speakers. If you can just stay for a few more moments. We have Dr. Leonard. We have a conversation about domestic violence, and then we have a lady who's flew here from California, Betsy McKinney, who's here to talk about a woman's movement. Is something that's going to happen May of next year. I really, 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 really want you to hear that information. If you can just give us a few more minutes. I'll ask the speakers if they can even cut a little bit more so that we can get through to everybody. Is that okay? Okay, we fed y'all, so hopefully you stay around for a while. In exchange for that, right? I'm sorry. If we can bring forward Dr. Leonard. And Dr. Leonard is, Dr. Johnson Leonard is a medical director from the Herman and Walter Samuel Breast Cancer Care Center, LifeBridge Health, Alvin and Lois Lapidus Cancer Institute. She's an awesome woman. Thank you, Dr. Leonard.
Good morning. I think this page down. Okay, so I had the best lead-in ever because I had somebody give half my talk for me, so that makes me be able to do less. And it makes me be able to look more, because one of the main reasons I love doing these events with my ladies of color is I get to see what you got on and what your shoes look like and what your hair looks like, and I can take ideas with me. Okay. So this talk is about taking information with you that you can use in your daily life. It is not about research. It is not about facts and figures for the most part. It is to give you tools to take with you. Because what is the point of doing all the work that you've done this week if you walk out of here with nothing that you can use the next day? So, the first thing I ask you to do is not ask yourself what you know. I want you to ask yourself what you really believe. Because oftentimes they are not the same thing. Every person in here is wildly intelligent. You are all brilliant, you are all beautiful. But sometimes what we know and what we believe are very, very different. Most of us, we know breast cancer patients are sick. They are more likely to die than other cancer patients. And those that don't die, well, you know, they live with chronic illness. What do you know versus what you believe? The fact is, many of us are afraid, and we should be afraid, of a cancer diagnosis, especially a breast cancer diagnosis. That's what we believe. Because frankly, the reason we're so scared is because there ain't nothing we can do about it. Okay? What do you know versus what you believe? Because many of us believe breast cancer is a death sentence. Used to be. It's probably still that way. And the mayor just told you we have one of the highest mortality rates in the state. Facts. 240,000 women plus were diagnosed with some form of breast cancer last year, and that number should be the same this year. And about 40,000 women died last year. Fact. However, the other fact is there are over 2.8 million breast cancer survivors walking around today. when we looked at women who were diagnosed between 2003 and 2009, almost 90% of women diagnosed in those years are survivors, and most of them are cancer-free. Okay? What we know versus what we believe. And even with our mortality rates here, your chance of dying from breast cancer is only about 2.7%. What is going to kill you? Heart disease. Not your breasts. Your breasts are your friends, not your enemy. Okay? So our expectation when you come to our offices, when you come see Jeanette and I, and we're smiling, because we're always smiling, our expectation is survival. Breast cancer is not a death sentence to us. When you walk in the door, we're like, okay, we're going to cure you. We'll see you once a year. Peace, see you later. Okay? Survival. Not what you believe. Now you know. So there's no excuse. Okay? First and foremost, everyone have that strong general knowledge. Recognize the signs and symptoms. Lumps, knots, thickening, dimpling or puckering of the skin, changes to the nipple, although rare, such as scaling or rash that does not respond to normal rash treatments, nipple discharge that's spontaneous and unexpected. As we age, which way should they point? Down. Down. If one of them suddenly starts pointing up, go see your doctor, okay? That does not apply to males. You all are very happy when what you got that points down points up, but that does apply to us, okay? New pain in one spot that won't go away, that's unusual for you. Those are all things that can be evaluated. And the bottom line is, if you are concerned about it, get it checked out. It doesn't matter how outlandish it seems to you, take your own instincts and your own feelings seriously. Understand your early detection guidelines. Monthly self-examination should be done for women starting at age 20. They have not been shown to change breast cancer survival, okay? That is the truth. But the other truth is, the first person who suffers when time becomes short or money becomes less is females. And one of the first things you give up is your doctor's appointment, your mammograms, and your screening test. So if you're not getting the things that you should be getting, check your breast. Because if no one else is, how are we going to find these tumors to make them go away? Clinical breast examinations are those done by a healthcare provider. I don't say doctor because there are many forms of healthcare providers out there. Between ages 20 and 40, they should be done at least once every 3 years. That's the recommendation. But since most women are getting their GYN exams annually, they get their exams then as well. After age 40, every year, clinical examination. Mammograms after age 40, every year, till you're not moving no more. We do not have a cutoff time for mammograms. If you are 88 and you are still hustling, driving, moving, going to church, living an active lifestyle, I expect you to get your mammogram, okay? Now, there are other recommendations for screenings and surveillance that are out there. I recommend that you talk with your healthcare provider about your family history and your risk to see what is appropriate for you. This is for your average woman without elevated risk. I do not believe we start mammograms at age 50. Jeanette and I see many women under 40. In fact, I saw 5 new patients this week. All of them are under the age of 50 with breast cancer, and I'm seeing 2 today. Okay? No waiting until you're 50. And how we all say, I ain't got time for that. Yes, you do. And you also have time to do your self-exams. It does not matter if you go in zigzags, up and down, in circles, in squares. Doesn't matter. Okay? However you do it is fine. The most important thing, you use that little part of your hand that you feel salt and pepper on when you spill something, not your fingertips. They are not your most sensitive. When you're cooking something and you spill something, we do this. We don't do this. Okay? It is just most important that you do it. I love it once a month. If you do it every other month, I'm still happy. I'm not happy with once a year. We miss things once a year. Okay? Know what you're looking for. Same thing. Lumps, new pain, nipple discharge, skin changes that are unusual to you. If that breast gets larger or the other one's suddenly getting smaller, those are things that should be evaluated. Partner with your doctor or healthcare provider. And your doctor can promote your breast health by reviewing your personal and family history, by performing those clinical breast exams, by ordering your appropriate mammograms. If your doctor is not asking the questions, doing the exam, or ordering the studies, ask them why. And if they're not sending you to somebody who does those things, find another doctor. We're not married to our doctors unless you're married to your doctor, okay? Find another doctor, okay? All those things should be part of your routine health, but go to the right doctor. Your podiatrist is not going to do your breast exam, okay? And don't ask him to, because then there's a lawsuit involved. If you're at increased risk, you and your provider will determine what the appropriate examination schedule and mammogram schedule is for you. And then you put this into your 9-step workout plan. Understand, healthy living is daily living. What did Dr. Linda say? We have so many tools and resources, there is no excuse. First, you recognize your new normal. We are old, we are saggy, stuff hurts, it don't feel good, and that's just the way it is. And I don't care how beautiful our skin looks, we cannot stop time, okay? No. There you go. Be a realist. Understand and recognize the life you have lived is real and has impacted your healthcare choices, period. Be aware, do not be afraid. As we get old, things change. That is the way that it is. And our husbands get on our nerves, and we don't like our children when they are teenagers, and that's where I am now. So, good Lord, I am so ready to be about 10 years older, right? Know your health care plan with your primary care provider. This is it. Develop your wellness plan. I am staying on time. She thinks I'm not on time. This is it. Develop your wellness plan in addition to your health care plan. Get emotional. Reconnect with your emotions and yourself. Understand the feelings and understand that how we perceive emotions changes as we age. But do not wallow in the negative. Because if you don't have that friend that you don't want to talk to because all she talks about is negative stuff, guess what? You are that friend, okay? You don't have to get rid of your wallowers, but you know you don't want to spend a lot of time with them. Reconnect. Home, church, family. Reflect, renew, rejoice. Optimists live longer, and then you take control. I'm done.
One more speaker. So we have 2 more speakers. Thank you for hanging here with us. We have 2 more prizes. Beth, if you can come and I'm sorry that you have to even cut your speech a little bit longer. But Beth Huber is going to talk about domestic violence. This is Domestic Violence Month, is it?
Yes, it is.
It is domestic. So we wanted to kind of keep you in tune and engaged. And so we're going to talk about domestic violence, and we have one other great presentation. So thank you for hanging in with us.
Hi, good morning. I can cut this a little bit shorter in the lieu of time. I feel very, I don't have much humor in my presentation as the previous speakers have, because obviously this is a very, very serious issue. It touches all of us, and I was asked to speak real briefly about just sort of the framework about domestic violence so that we're all kind of working from the same point. But then what can we do? What can we do for each other about this very important issue? I would like to say this. The important piece of the definition of domestic violence is it is a pattern of coercive behavior. It is not a one-time event. These patterns exist, they repeat themselves, and the intent is to exert power and control over another person. It is demonstrated through different kinds of behaviors, physical, emotional, sexual, financial, quite a gamut of type of, many of us think of domestic violence as just the physical piece of abuse, but it truly is much bigger than that. If you look at these 3 women, which one of these women is being abused? You can't tell, correct? You can't tell. At Sinai, I'm a Sinai employee as well, we talk with healthcare professionals about this because we have a mechanism for screening patients who come to the hospital. And it is the most sort of frustrating but not uncommon for nurses and other healthcare professionals to say she doesn't look like she's being abused. I'm trying to show you that you can't see the abuse in this picture. Domestic violence does not discriminate any age, socioeconomic group, race, ethnicity, women from different sexual orientations, urban, rural. It does not discriminate. It is prevalent throughout our communities. Domestic violence is built on this premise of this power and control. And I'm not going to go into a lot of detail about this, but there are mechanisms that the abusive partner uses to, again, exert this power and control over his victim. And it involves many of these, the male privilege, it's financial abuse or economic abuse, cutting people off from their finances, threatening, coercion, using children as a way to keep control, blaming, isolating, things like that. And this wheel, it was developed in the early 1980s when a group of women came together and shared how they were managing the abuse in their lives, and they put it together into this power and control. We use this all the time as a teaching mechanism to help people understand the dynamics. The other dynamic that we use over and over again is that there is, and this happens, just unbelievably, this happens again and again and again, is the cycle of violence. 3 phases of it where a woman will be thinking, something's happening here, I'm not sure what it is, he's getting agitated, I'm walking on eggshells, I'm trying to keep the peace. That moves into the actual abusive incident, and then it's followed by the honeymoon phase, as we call it. And that's where he is very apologetic, he promises things won't happen again. She's feeling comfortable that, okay, I don't know what just happened, but it's over, we're good, this is the man I fell in love with, I'll be okay. But sure enough, back around it goes. The only difference in this cycle of violence is that there can be varying time frames between each of these phases. So if something happens in October and then it doesn't happen again until April, we call that intermittent reinforcement. It's gone. I don't know what that was, but it's gone and it'll be okay. But sure enough, around it comes. And what we do know is that cycle often becomes, if it was that many months apart, it becomes shorter and shorter and shorter. So sometimes a cycle can be in a day's time instead of across months. It can even be in an hour's time, quite honestly. So many people ask us, why doesn't a woman leave a situation? If you go back to that power and control, you'll see these, that's what he's doing, he's controlling. If she's isolated, where is she gonna go? If she's psychologically beaten, she's so broken she doesn't know how to get out of that situation. If he's controlled her finances, how am I going to survive without money? And often there's the physical threats. If you leave me, I will hurt your mother. If you leave me, I will kick and kill the dog. Things like that. Other obstacles to leaving is this optimism or versus realism, hoping that he'll change. There's a lot of people who just are forever optimistic about that people will change and that sustains this. Believing that there can be help, that I can help, the promises to stop. He might be in a batter's program, or we do know that women are in most danger when they are preparing to leave, and so she is worried about the repercussions of leaving. The important part for today is how can we help? How do we help each other? So here's a little do's and don'ts list. We need to listen. We need to believe and support. Women are not believed about their stories. Often an abusive man is very charismatic with the rest of the people in a person's life. Very charismatic, so people do not believe this is happening. Refrain from giving advice. People need you to listen. They don't need you to say, why don't you leave? Why did you do this? Why did you do that? We also want people to acknowledge the limitations. It is very difficult work, and some people cannot help somebody in the circumstances. And if you can't help, then share resources. Help somebody find a place to go. And very importantly is safety planning. Many people choose to stay in the situations that they are in, but we try to teach people how to be safe within those situations. And a very important thing that somebody can offer to another woman is, we talk a lot about codes, plans, that if I call you up and say, let's go get an ice cream cone, let's go to a movie, that's a code to your friend, your sister, your mother, your daughter that says, I need help. It's a secret way, if you will, for asking for help. The don'ts are, don't forget the focus. It's not uncommon for people to say, oh, let me tell you about another story that I know of, or, oh, just be there listening and keep the focus. Don't judge, don't blame, and most importantly, do not give up on somebody. This is something that you can look up. It's a good thing just to check. The loveisrespect.org. It scores it for you. You can share it with your friends, your family, your daughters, your mothers, just to get a sense of where you are in your relationship. And just let's stay in there and help each other and be a survival, just like Dr. Leonard said about being a survival with a breast cancer. Let's be survivors in this as well.
Thank you so much. Incredible information, do you think? Yes. Okay. I want to bring up our last speaker. I want to tell you a little bit about her, and I'm glad that you're here because you're getting a sneak preview. You're going to get information that most people in this region will not have. Betsy McKinney flew in from San Francisco to be with us today. Actually, she was here last night because she wants to tell you about something that they're bringing to Baltimore for women in May of 2015. After we hear from Betsy, we're going to do 2 more drawings. And again, thank you. And then we'll open, and hopefully, if you have any questions, we'll deal with that then. But we're going to listen to this for just a few moments and give away some more prizes.
Good morning, everyone, and it is such an honor to be here in the room with you. It's your leadership in the Baltimore region that is really setting the stage for a future of prosperity and inclusion, as we know, for the next generations, and women's leadership is at the core of that possibility for the future. So I want to tell you about It's Time 2015, the Partnership Summit to Elevate Women's Leadership. It's a 3-day summit that will begin May 1st at the Hippodrome Theater, and will continue at the Baltimore Convention Center May 2nd and 3rd. 3,000 women and men will be attending here in Baltimore, and thousands more will be connected through 13 satellite cities across the country. We're often asked, so why did we choose Baltimore for the inaugural national convening on women's leadership? And there are 2 reasons. First, I have the pleasure of telling people about the amazing leadership of Mayor Stephanie Rawlings-Blake in championing women and minority-owned businesses. It's her leadership in the region, with her team and Sharon Pinder, and with all of you in the room, that Baltimore is the powerful example of putting promise into real action here in the region. So it's going to be a tremendous honor to highlight and celebrate all of your work at the summit in May. The second reason is symbolic. Women and minorities are not at the decision-making tables in sufficient numbers yet. Women's suffrage began in upstate New York at the Seneca Falls Convention in 1848. We've come a long way since then. We are present in DC and other state capitals, but we're not there in sufficient numbers yet to help determine the future of our world. We're convening in Baltimore to determine how we are going to get there. So the last time we all looked, 50% of the population is women, but we're less than 20% of Congress. Only 5% of Fortune 500 CEOs are women. Business entrepreneurship and small business is where women are leading the way, but it is time to change the numbers, and it's time in 2015 for a partnership summit to elevate women's leadership. And that partnership summit includes men. This is not just about women. It's not just a furthering of the women's movement. This is a movement of women and men who know that partnership is an essential characteristic that we need to model for our children. The balance of power between men and women is directly related at the national and political level to the very scenes of domestic violence that we're seeing. When there's an imbalance of power at our political level, it has repercussions everywhere. We're living a legacy of that imbalance of power, and it's time to change. The summit's going to highlight not just women's organizations, but men's organizations working to elevate women's leadership, men's organizations nationally and globally that are working to end violence against women. Our business sponsors are leaders in their industry, bringing women into the highest levels of their country. We will also be highlighting women and men political leaders calling for women's leadership. As a member of the Clinton Global Initiative, I've been meeting with elected officials at every level. Senator Clinton, Leader Pelosi, Representative Donna Edwards, Senator Mikulski, and so many others on both sides of the aisle know that we need more women in Congress. So the summit will showcase and highlight women leaders across all sectors. As we've seen even today, the interdependence between these sectors and issues of health and the environment, of business, social justice, education, and media, and all of our sectors is critical. Our health is interdependent with the health of the environment, and our democracy is interdependent with an informed and engaged electorate. So it's time to connect at every level now. So we need an annual cross-sector convening to build our capacity for collective action and collective impact. At the Partnership Summit, we're going to explore how do we use our collective economic power, our collective political power, and our collective cultural power to produce change when we're not yet at the tables for making decisions in sufficient numbers yet. We can do it still away from those tables while we get ourselves to those tables. And we're going to show how that change is already happening. If we want more women elected to office, we can elect them. If we want a sustainable future, we can purchase it tomorrow. If we want to make cultural change, we can work with our iconic cultural leaders to promote that change across generations. But we need the capacity to work in partnership at a new level. So the National Summit will be the launch of a network of networks that will build the connection between local and national leaders. We are developing a National Advisory Council that's forming a network of networks to represent the rich diversity of people in our country, of who we are and who we are becoming. We're honored to be working in partnership with Dolores Huerta, Melanie Campbell, Alicia Garza, and others as key advisors to the initiative. We need more connection between the local and national levels, and between grassroots and grasstops leaders. We also need, and I think everyone in this room will agree, we need increased funding for all of our good work. To support a national network of networks to empower women and girls, the summit will be the launch of a first national cooperatively owned social enterprise. It will be the opportunity for us as women to actually own a business enterprise that 100% of its profits will go to be supporting our work. So this is a personal invitation to you to join us in May. Sign up at the website. You'll get important updates about the conference registration launch and other parts of the conference that are not yet developed. We're working closely with the mayor's team to determine how best to support your work locally and to build a regional advisory council of 39 here in the Baltimore, Maryland area. That advisory council will be connected to other regional hubs and the National Advisory Council. I think we all know that the challenges we're facing in the world today are daunting, but together we're already transforming the world for our daughters and sons, for our families, and for our democracy. At these annual gatherings and at this inaugural gathering, we'll have a chance to work together at a level we've not yet had the opportunity to do, to build our collective impact. It is time to step up and to build partnerships with women and men to elevate women's leadership. We're starting here in Baltimore, May 1st through 3rd. Please join us. Tell all of your friends. Sign up at the website for the updates, and we look forward to seeing you there.